New trends in health tech are putting more information into the hands of patients. Dr. Bertalan Mesko is a medical futurist and author of The Guide to the Future of Medicine. He explores disruptive technologies helping patients across the world. I spoke to him about some of the most exciting and controversial developments in health tech.
When I saw with my own eyes last year when a patient who had a ski accident decades ago and was paralyzed from the waist down started talking about her dreams and how she didn't give up. She started putting on an exoskeleton while sitting in her wheelchair, and then he turned on the computer in the backpack and she stood up and walked around, just like in a science fiction movie. So the issue that we are facing with ever improving, ever increasing medical technologies is that what if we don't just level up to the healthy level, but we go on, we improve, we augment human capabilities? What if people can jump higher, run faster, or be smarter with brain implants because they can afford it, they can afford the use of technologies others cannot?
Will it just be that people who have money are able to be genetically improved, whereas people who can't afford it may end up getting left behind?
Absolutely. If we let technologies go on at the rate that they are going on right now, that might happen because we are not prepared. Decision makers, patients, medical professionals have no idea how to adjust to these new needs from patients, plus to the new technological improvements. So you can see that very soon, technological and plus financial differences will create biological differences between people, and that is going to cause chaos in the medical system. That's why I'm saying in my book that we need to start preparing now. We need to start initiating public discussions about all these ethical considerations and the potential issues that we will face soon. Otherwise, it's going to be late, and the almost exponential technological changes will wash away the medical system, making it a purely business-based service without any kind of human interaction.
One of the ethical concerns that Professor Stephen Hawking had about artificial intelligence was that eventually the technology would become smart enough that it would actually supersede human beings. He said it would take off on its own and redesign itself at an ever-increasing rate. Humans who were limited by slow biological evolution couldn't compete. So how worried should we be about this?
I believe that I belong to the most optimist futurists out there, but I still believe that artificial intelligence will have the chance or potential, just like how Stephen Hawking said, to cause huge issues in the future of humanity. Because how one can make sure that we can control the developments of artificial intelligence when it becomes super intelligent, creating, designing its own future. So I believe that, yes, we should be worried about that, but no, not yet, because we are a bit far away from that, at least 1 or 2 decades from that, and we still have a chance to initiate public discussions, invite experts in bioethics to make sure at least we have some regulations by the time there's a chance that it could happen in real life.
Now, I'm going to move on to social media, obviously something that started in college dormitories connecting students, and now it's an integral part of businesses everywhere. So what role will social media have in medical health tech?
What did people do before? People got a diagnosis, they went home, they discussed the issue with their family members, maybe the neighbors, and that was it. But in many cases, there are rare conditions and rare symptoms, and people, like-minded people, can only find each other through the online channels. And social media proved to be that kind of potential, that kind of channel, the bridge between people, the minds of people, for medical professionals, crowdsourcing medical diagnosis, or between patients who just share the same kind of symptoms and they need some support, some emotional help from each other. And with social media channels such as Twitter, Facebook, Google+, YouTube, and blogs, now they have a chance. They can find each other, create patient communities, and discuss things they can never discuss in the doctor-patient relationship. Plus, medical professionals themselves can discuss cases they cannot find a solution at their local hospital or clinic, but this way they can find experts around the world without any kind of geographical limitations and get the information, get the answers that they actually need.
Now, as they put this sensitive information online, is there a danger when it comes to data breaches that this very personal, private information could become public?
So yes, there is danger for that, and that's why we need to be aware of privacy settings and options. That's why we need to be the pilots of our online presence. We need to know the privacy settings of our own social media channels. We need to know whether we use a really good community site in which only, for example, medical professionals can become members. Plus, we need regulations and laws like the law called GINA in the US, which prevents employers and insurance companies from asking for genomic data from their employees or insured people. So we need organizations to take care of this. Plus, individually, we need to be aware of all these privacy issues.